Get to see any of everybody.
Okay, you're on.
Hi, I'm Rose Brunsma from Grand Rapids, Michigan. And the first procedure I had for weight loss was the LapBand. And I chose that because I thought it was going to be the least invasive procedure to get to lose weight. Unfortunately, I had some complications with swallowing and things, and ultimately gained back all the weight I had lost plus 10 pounds. So Dr. Rutledge, through Gil Gerard on television, I saw the program, and I thought, I'm going to investigate this. So I did. And I signed on to the Yahoo group, and I read a lot, and I listened, and I kept my mouth shut pretty much of the time because I wanted to hear what people had to say about this surgery, and it just seemed like the right way to go. I had promised my daughters I'd never do the Roux-en-Y, and I still will never do the Roux-en-Y, but I felt this was a chance to lose the weight, have it gone, and be able to chase my 2.5-year-old granddaughter around without her outrunning me all the time. And so far, this recovery has been miraculous compared to the LapBand. I actually can burp now. I feel gurglings in my stomach that I haven't felt for 3 years. I had the band on July 9th, so this is kind of a nice way to celebrate the anniversary of getting rid of the band. Having the
4th of July, the freedom from the
right, I
band.
told you my stomach was going to jump up and shout for joy when the band came on.
Independence, right, yeah.
And other than some soreness and some bruising, I was kind of a bleeder after surgery, which I've never had that experience before, but every time I'd get up and move around, I'm thinking I'm fine, and somebody'd say, oh, you're bleeding. So I would trot right back to my bed, and they would patch me back up again, and then we'd try it again later on. So it's been a positive experience. This morning I felt a little shaky, but that's the first time. So
when you felt shaky, did you try taking some salty something?
I did, and it finally passed after here, but I'm wondering, my blood pressure was high before I left, and they gave me something for it, and I have continued to take my blood pressure medication.
Have you checked your blood pressure this morning?
I have no way to. So
you need to get one of those wrist blood pressure cuffs.
Okay.
And what you can have is, as you are having the effect of the surgery plus your blood pressure medicine, as you're flying, that could be too much for you, and you can have a passing out and hit your head thing.
Right. Plus I was taking 0.5 milligrams of estradiol.
Yep, estradiol, right?
Yeah, right. And so I haven't had that for a couple weeks too, so I don't know. I feel good right now though.
Yeah, but we need to check your blood pressure. You need one of those. They're about 40 or 50 bucks. You can get them at Walgreens or Walmart or something like that. And check your blood pressure 3 or 4 times a day. We would expect by this time that it's time to come off your blood pressure medicine.
Okay.
So go ahead and do that and call us.
Okay, real good. Thank you.
So can you feel different when you swallow now?
Absolutely.
You can feel the band is gone?
Right, I don't feel like there's a fist in the middle of my chest.
But remember too, your story, if I remember right, is you saw a gastroenterologist who said that the reason for your swallowing problems was not the band, but your bad esophagus.
That's right, my esophagus.
But you still have your bad esophagus.
I still, yes.
But no band.
I do.
Now
It's
even
right
with your
there.
bad esophagus, you're swallowing okay.
Absolutely, yeah. It was almost immediate. Almost
like
immediate
when the
release.
band came off, you got better.
Absolutely.
Almost?
Absolutely. No, it was immediate, the release. It was like I could swallow again without feeling that constriction around my esophagus. So that I'm grateful for forevermore, just to have that feeling.
Is it okay if we take your staples out?
Absolutely.
Do we have your staple remover?
Yes, I do.
Oh, okay, good. You just stay right where you are if you don't
All
mind.
right,
Is it okay to do it on the internet for the whole world?
Well, you know, he didn't like me. I was the bad patient.
For the band patients, we bruise them.
Yes, you do.
Wait.
These 2 ports were the ones that kept
bled.
bleeding.
Right.
For who knows what, I didn't have any pain.
Well, the reason is because you were stabbed with a spear.
Well, I
and
know.
people who have the unlucky situation where the port goes through a blood vessel, you'll have some bleeding. And if it goes a little bit, an inch to the right, they won't. So it's just a matter of luck.
I figured you hit a little bleeder there.
Yeah, exactly.
Right.
So. But it's never anything serious. It's just a matter of annoying. It's not anything risk to your life.
I mean, I wasn't aware of it. Other people would say, you're bleeding.
One more, I think. Applause?
Thank you very much. Good. Thank you, thank you.